with the Health Director, Lieutenant Commander Seneca Smith. He's joined by Senator Roger Ballinger, and we're going to be discussing where we're at, how things are going. We just need to get out and let the community know what's going on. So this will be a combination press conference and community meeting. We invited the press here to the meeting here with us this afternoon, but we also want the community to be a part of this, because we feel like as a community hospital that it is, that the community is an integral part of the operations of the hospital. So without further ado, ladies and gentlemen, I want to introduce you first of all to Principal Chief George Tiger.
Before I continue, I certainly want to recognize one of our National Council representatives from the Okmulgee District. Please make welcome David Nichols. Thank you for coming. One of the things that I know that there's been a lot of concern of who has provided services at the formerly Okmulgee Memorial Hospital. And we just wanted to clear up some misinformation we feel like that was out in the communities. We invited our friends in the media at the local level to come and join us, because we believe that we keep it within the communities that we serve, and who is interested in what's going on out at the facility, that it would be win-win for everybody. Want to also let you know that since we've taken over the hospital a mere 10 months ago, we knew that the doors of that facility could not be closed, because as I share with my colleagues and tribal leaders throughout the country, that any time a medical facility is closed in a small community like Okmulgee, the results are just disastrous. I mean, we had to keep those doors open, and so we did. And in 10 months of the $4 million debt that we acquired, we are now at just a little over $320,000 and taking care of the whole debt. So we have been able to bring some resources that we knew that we could. Again, the thing that I like is that everything that we're doing is community-based. Whether it's Muscogee Creek Nation, whether it's the citizens of this community or surrounding communities, we want them to feel at home when they come to this facility to get quality health care. Now, we have had some glitches, and that's what we wanted to address today. I will defer here just a few moments to Lieutenant Commander Seneca Smith. But before I do, I want to tell you about this relationship that we have with this community and other communities that we share throughout the Lincoln County area. We feel like that whenever we can join partnerships together, that it's a win-win for everyone, and that's what we've done. Here locally, our capital city, I think we've been able to do some things that we through the resources that we have. We're already hearing from other tribes regarding sending patients outside of our jurisdiction, outside the state of Oklahoma, to what was formerly George Center. We have an understanding of the government, and we're starting to see some of those things happen. And I know that means a lot to this community as well as to the Muscogee Creek Nation. And so with that, I'm going to go ahead and defer to Lieutenant Commander Smith, and I want to also recognize the city manager, former State Senator Roger Ballinger. Roger and I grew up in this community. He and I share a lot of things in terms of where we come from, but more importantly, where we're going as a community. I believe that partnerships is being solidified through some of the things that we're doing here locally. So with that, I want to go ahead and defer to Lieutenant Commander Smith.
Hello, Chief Tiger. It's good to see everyone today. Just like Chief indicated, anytime that you start a project or any type of project, you hope that you have everything planned out. And, we did have some minor glitches, but they were just minor glitches, and we were able to overcome them and move forward. But before I get into all that, like Chief indicated, over a year ago, we started the process to assume the Okmulgee Memorial Hospital, which was around a year, was it July 31st, 2013 is when we started this whole process. Okay. And then at that time, the debt of this facility is around $5.1 million. Okay. The AR was of that 5.1 million, it was 3.1 million. The long-term note was around 2 million. And at the change of ownership around December 30th, when I talk about change of ownership, that's the process that we took to move forward with fully ownership of this facility. The debt was around $4 million. And as we move forward, and as to current date, we have the debt down to around $300-something thousand, or to be exact, $327,000. And then that was very important for us, that we feel that we had to reduce and to totally eliminate before we made any big changes at the facility. You know, at that time we brought in Wise Quality Group, its accreditation, that helped us go through and prepare for the accreditation. That is one of the most important things that we thought, because we have our facility in Okemah, which is accredited, we wanted to accreditate the Omogi facility, so we brought in an accreditation body that kind of helped us identify where we're at and where we need to go for moving forward with that process. So there were so many steps that we took that when we took over. You know, during that process, one of the big things that we identified that hindered a lot of progress in the facility was some of the mechanical issues. We have invested about $350,000 into those issues, and everything's on its way. You know, the big item that was a big concern was a chiller, and that kind of hindered. You know, that has to do with our surgery and running the facility. And so we have a lot of those items that we're working on. You know, we just assumed that officially 6 months full ownership. 6 months we've been working on this after the change of ownership and licensures and everything like that. So we're working very diligently to make sure that we reduce that amount of debt before we move forward. And we've identified over $350,000 mechanical issues that we have to address. And as we move forward, you know, one of the big items that we, you know, services is very important. You know, we're invested in the community. You know, that has always been the top priority for the Muskogee Creek Nation, is that we keep that facility a community facility. You know, as we move forward with Dr. Nichols, that's our orthopedic physician. You know, anytime you move forward and implement electronic health record, there's steps that you have to take. We wanted to make sure that anytime that we bring anyone in, we don't want to overwhelm anyone. So once we brought our orthopedic surgeon in, we wanted to make sure that he was able to adjust to the system we have and make sure that he would be able to ease his way into the patient load. And so that was one of the reasons why we've kind of held back on some of the patients that we were able to see in our facility. And so, and all that's been taken care of, and now we're seeing everyone. So it wasn't just non-native patients that were being limited. It was native patients also. We were kind of trying to ease him into the system and kind of work through a backlog of orthopedic work that we had. So that was probably one of the main items that we wanted to discuss today, was our orthopedic surgeon. You know, that's our first full-time orthopedic surgeon we have. We're in the process of adding an MRI, a $1.7 million project that we will be adding to the Omogi Memorial Hospital, or Muskogee Creek Nation Medical Center. It's going to be located right north outside the outpatient entrance of the hospital. So that facility, or that building, is going to be a fixed building, and it's going to be here in September. We've ordered the magnet, and it won't be, we'll probably be able to see our first patient around November, end of November, beginning of December. We shot for October 1st, but we didn't include getting the staff ready and making sure everyone's trained on the equipment. So we pushed that back, and you know, we just approved through our National Council on Saturday to move forward with that construction project. So we're very excited about adding that to our community. And also the ER. We're very invested in the ER and make sure, because that's what brings people to our facilities, the ER, and having that access. We will be removing the modular building that's located outside of there. We began that process to remove that facility. And we hope to add another 5,000 square foot fixed structure similar to the MRI building that will be located at the North facility. So we plan to bring in another fixed structure on the south located to the ER, where we hope to expand the exam rooms and improve that workflow that we have. General surgery, we're working with OSU. We were working with OSU when we first came in, but that was kind of on an emergency type basis. Now we will be working with them on a full-time basis for surgery, so we're very excited about that relationship that we have with them. Our Hope Unit, we just hired our first full-time psychiatrist, and very excited about that. We're doing a lot of improvement. We're looking at over a $200,000 project improvement there in regards to bringing in beds, new beds. We need to bring over $100,000 in upgrades into the beds to that unit, and about $100,000 worth of renovations to that specific area. Full-time pharmacist, we've hired a full-time pharmacist. Our family practice provider, unfortunately our current provider is moving out of state, and so we have made arrangements to where we have a full-time family practitioner that's coming in who is also an anesthesiologist, and then we will be adding a mid-level with that provider within the next several months. So that provider was Dr. Galloway, who was seeing the community. So we may be losing one, but we're going to be adding 2 providers to that area so that for the community. Our sleep study, we're currently working on that, reviewing the contract there. Our home health, we're still looking at relocating our home health. And one of the big major projects that we're implementing right now is our EHR. We have a CERN that currently had an EHR, but what we're trying to do is we're trying to make sure that all our facilities are on the same EHR, and they'll be utilizing the EHR CERN. And that's over close to a $2 million project that we're implementing at the facility. You know, as we, like I indicated, when we entered into this, we've been very excited, and we still are very excited about this opportunity we have. And the main message today is that we are here for the community, and that's why we're making the major changes that we're making. We have a lot of capital that will be going into this facility. Anytime, as we have been in this business for a while, and as you have, it's going to be a roller coaster ride for a little bit until we're still learning how to work with each other. We still have a lot of updating and policies and procedures and everything that we need to do as we move this facility to the next level. We just broke ground on Okima, getting ready to break ground on Eufaula. And once those facilities are completed, we're looking at about an 18 to 24 months after those facilities are constructed. And after that, hopefully we'll be ready to break ground on a large-scale facility here. That's our ultimate goal, is to build a large-scale facility here for the whole community. From this point on, you'll start to see a lot more advertisement we'll have advertisement south of here, north of here. You'll see a lot of billboards start to go up, and advertisement to the community, what we have, who our providers are, what services we provide. And so I'm going to thank you for this time today, and thank you. The items that we needed to address. I think what has been out there is that if we provide services to non-natives, we wouldn't be losing our federal funding. That's not correct. Kind of how all this, we are a 638 compacted tribe. We compacted our health services. And a lot of what we had to do is we had to make sure that these services, the services of the Old Mobile Memorial Hospital and the PRC, are within our funding agreement. So the funding will still be there for our native patients, and that's not going to go away, and that funding will not be jeopardized, and there will not be any federal funding utilized for the non-native unless it's for grant purposes. So we just kind of wanted to make sure that there's clarification on that specific issue there.
Thank you, Seneca. Anyone have any questions? Any questions about it?
Chief, could you just, because a lot of people don't understand how bad a shape the hospital was in, and so looking at the tribe, you took over something that was literally within, months of going out of business, and say that, would you just comment briefly on that? I know you spent money, but the tribe's thoughts on actually say, because it was going out of business, financially.
Right. You could probably get more into detail, but what I want to share with you is that when we came in as a tribal administration, we knew health was a priority. I think health is a priority for every citizen, regardless of who you are. When this was proposed, I know that I talked with Neville and some other people about how we can join partnerships, if we can do that. We looked at all options, and we saw that this option was probably the best way. And it was literally on these last stages. I don't know how many of you know that it was a battle each month just to make payroll. And so, anyway, we knew that we could provide some resources that maybe they didn't have available. I know a big political snafu, if you will, is the Obamacare. We don't look at it as Obamacare or Republican or independent or anything else. It's affordable health care. But as a nation, we're provided more or less kind of a set-aside where it wouldn't affect us as a tribal government. So knowing that resource was available, we went on ahead and pursued some other options as well. So he can get more in detail about it.
Besides the financial impact that the organization was under, anytime that you have your third-party revenue that you're bringing in, your third-party revenue, that needs to be put back into that facility. So a lot of that money was being put towards the debt to pay off the debt. And so when that happens, and then you get in regards to capital equipment not being updated, resources not being updated, the facility not being updated. So as to going into the specific details of everything, the facility was built in 1968 and a very outdated facility. To keep it open, all the financials were going towards that area. So they kind of, which one do you choose? And so they wanted to keep people with their jobs, keep the individuals that work there with their jobs. And so there's some decisions that had to be made. A lot of outdated equipment that we needed to update. The physical structure is probably one of the biggest concerns that we have right now. Because right now it's limiting us for providing surgery services until we get in there and I think that mechanical work that needs to be done in there. The equipment, employees needed resources updated, needed monitors, the list goes on. And we're finding more and more every day. And so we still have a long road ahead of us to adapt, and we identify something new every day. But what we're doing is we identify it and moving on. And that's the best thing we can do right now. But we're still able to provide good quality care from that at the facility. We have great staff there that are very diligent in their work, care about this community. They're all vested in this community, and we're all working together right now to move forward because we have a direction, we've set the direction, and we're building relationships and moving forward. Yes, sir.
Yes, Seneca, I think what might be noteworthy is the fact that the administration and yourself had definite plans to build a new hospital, just a Creek Nation hospital in Okmulgee, but decided instead to do a partnership by taking over the Okmulgee Hospital.
Yes, like we indicated, we have $13 million a year that goes out for us to provide secondary and tertiary care. And so we were looking, as we sat down when we came in, is that we've always attended and planned to build a facility here. And it was going to be a native facility. And then as we started to sit down and we started to meet with the community and kind of understand what shape the facility was in, we decided to move forward with a community facility. Okay? And so that's what brought us to that decision. We sat down and we met quite a bit and felt that since we're here, this is where our central location, right in the middle of all our clinics, and this is our capital, that let's try and to move forward. We're shooting for, we hope to build over a 300,000 square foot facility with OB services, cardiology services, oncology services. As we start to line up, we want to make sure that, and if you look around for OB services, you either have to go to Oklahoma City, you have to go to Tulsa, and I think there's limited in McAllister and limited in Muskogee. And you know how many people drive by or drive through Okmulgee to get to Tulsa, to get to Oklahoma City. So we want to make sure that we have all those services here. Because our patients in our community, they do not want to drive to Tulsa and Oklahoma City if they do not have to. Yes, sir.
Lieutenant Commander, is the bed size of the hospital the same now as it was when it was taken over?
Yes, sir. We have still the same number of beds.
And what is the occupancy been since you've taken over? Has it been maintained or has it gone up or fallen?
Well, it's been maintained and gone up, and it always depends on what season it is. Okay? Come December, January, it'll skyrocket again. And so it just always depends on what season it is. But we've maintained, and we've increased probably by an average about 5 or 6 plus above what the maintained level was.
And the emergency center is still operating at about the same pace?
It's getting ready, yes, and it's getting ready to increase quite a bit. We feel that, you know, now our native patients will be able to utilize that facility for ER beginning Wednesday. And so we also feel that it's going to increase quite significantly. Yes, ma'am.
I had several questions submitted online. I'll try to touch on a couple that you haven't answered maybe directly. Are there any possible plans for the hospital to become an IHS facility when the trust goes into effect? Will anything change at that time? Are there any thoughts on that?
Well, right now, you know, we're a community facility. Okay, it's, you know, we've been in this business before. We currently operate the Okima Community Hospital as a community hospital. Okay, here we just have way more services, and it's open to everyone.
Okay. Can you talk about the urgent care? Can non-tribal citizens participate in the urgent care?
At the urgent care at the clinic that was specific for natives only. What we're getting ready to do, this comes along with the ER. Once we rebuild onto the ER, we're going to open up a fast track, and we're going to we have on the plans where we'll be working on an urgent care type facility that everyone will be able to access. Good question.
Thank you.
Do you have any estimate of time that urgent care would be open for the community?
Well, what we got to look at, you know, as I indicated before, we want to make sure that we get that $327,000 down to zero, and then that will open up the door a lot for us to put some of that revenue towards that type of project. So hopefully within the next year that we'll be able to get that accomplished. We're hoping before that, but it depends. We got to remove that building, we got to bring another building in, and you got to anticipate about 6 to 8 months. What we're going to go ahead and do is we're going to open up the fast track, and then if we can open up the urgent care probably in a different building, we'll go ahead and get that started.
I have one other question. You're saying that your hospital and your facilities will all be open to any comers, not just native?
Yes, ma'am.
For all services?
Yes, ma'am.
Okay.
I don't know, I missed this and when you were speaking. All of the monies that come into Muskogee Nation to set up the hospital and the buildings and everything, money all come from Muskogee Nation or from grants from the federal government?
For the facility?
Yeah, everything.
Right now, that facility is specifically third-party revenue agreement. There's no particular grants that help fund that at that time. We depend on the money from the insurance from those individuals that come in to run that facility. Now, a lot of our different programs and clinics, we have federal funding, we have tribal dollars, We have travel, we have grant money that run out of that particular facility. It's strictly third-party revenue. What we have done is implemented our best practices that we've had from our system to help decrease a lot of that debt that has been in place. You know, this has been very exciting for us to be able to do this. You know, very excited that the expertise that we have to able to make this project work. You know, and as we get a little bit deeper, a little bit further into it, we're very excited every day because we know what we're about to accomplish and what we're about to do in this community. Like Chief Tiger said, you know, health shows no race color. That's for, you know, health affects everyone. Everyone here in this room is a consumer of healthcare. What we have to be ready for is the consumer demand. That's what is driving healthcare right now. We're having to make up several years of updating that has been missed and then compete and keep up with what healthcare is doing now. So that's why we need to hurry up and get in the facility because it comes into electrical, mechanical. So we have to be working day and night to make sure that we get to where we need to. Are there any other questions? Yes, sir.
One other thing to mention I think would be noteworthy is that I think it's been mentioned several times that this hospital certainly would have closed within at least a few months. How many jobs have been saved because the Creek Nation assumed the operation of the hospital?
About over 200 jobs have been saved. You're absolutely right. It come down to months, and it was a week by week being able to provide payroll. And that's why thankful for the executive office and council that worked together, that we were able to meet quickly so that we were able to move forward in a quickly manner so that we can save the community the jobs of the individuals that work.
Earlier, you mentioned a cooperative effort with OSU. I'm assuming you're talking about OSU Medical School in Tulsa. If so, expand on that.
Well, right now, the OSU has an excellent program for physicians in rural health. Okay? Excellent program. We have started moving forward with those students being able to train here in our facilities. That main focus of OSU physicians is rural health care. So they were very excited when we took over that they were able to send students here. So they're having to send them all over the state. Now we're able to send them right down the road. And that's one thing that we have to get back to doing. You know, we have the opportunity with OSU, OU, and collaborate with even the larger hospitals that are out there. We have a great working relationship with Hillcrest, St. John, St. Francis, and so we've all sat down and kind of see what we can do to help each other and for the benefit of this community.
Will you hire the best and the brightest if it comes down to the point that it's hiring non-tribal? Are you out there seeking the best and the brightest?
Absolutely. Quality of health care. That's what we're about. We want the best, the brightest, the individuals that are vested in our communities. We have a lot of individuals that have left here that are in medical school, nursing school, that are wanting to come back home. So we want to take full opportunities of those individuals that are wanting to come back. That increases the quality right there because they're from here and they have that caring aspect. In the past 2 years, we've hired physicians that are residency right out of the Cleveland Clinic. We have an individual from the Mayo Clinic who grew up in the Walika community that's coming back home. We have several OSU students. We have one of our podiatrists who I mentioned is from the Cleveland Clinic, one of the best residency programs in the nation, that and the Mayo Clinic. And we have those two individuals that are working in our system. As we move forward, that's what it's going to take. We have to provide good quality health care. We're going to have those individuals here. We're working very hard to work with those institutions, those training institutions, to let them know that we're here and what we're doing and what we're about and what we're trying to do. And so that is always our ultimate goal. Are there any other questions?
Thank you very much. Again, I want to thank you for coming this afternoon and allowing us to explain and enlighten you about some of the things that's going on with the facility. We feel very confident as we move along that this facility will continue to improve on the quality of health care that we provide here in this community. In addition to that, the ability to have partnerships here is very important. This is our capital city. We use it as a blueprint for other communities that we share with in the Lebanon County area to do some things in partnering with them because it's important that we help each other. And having said that, at this time I'd like to ask City Manager Ballinger to come up and make some comments.
Thank you, Chief. I just want to express my appreciation to Chief Tiger and Lieutenant Commander Smith for the work they've done. You know, as your senator for the last year and a half, I've received numerous calls from people concerned about our hospital. At that time, there was not any knowledge that the tribe was interested, but it was obviously had some problems. And I felt very helpless as to what to do about it because it was deteriorating pretty fast. And had a lot of calls from employees and doctors and nurses and other people that had some huge concerns. I don't know what the outcome would have been, but since the tribe has taken over and from the day they began to show interest, there was some renewed hope with me and with those phone calls. But then the phone calls now have changed here lately to other problems. But I think, as we've heard here today, it's been 6 months, folks. It's a huge undertaking to mesh the tribal interest with the community interest and to cover all the bases. So we've had some glitches. There may be some other concerns. Some of them may be solved in a way that everybody likes. Neither parties might not be happy. But I really appreciate the work that's been done. Just the debt recovery alone is enough for us to really be grateful for. To echo what Chief Tiger said, community hospital with smaller cities in Oklahoma is absolutely vital. And I really appreciate what's been done so far. I'm not going to stand here and say we won't be back here again and have another meeting in 6 months. I know they'll be glad to do it. In fact, I think it would be a good idea to have an update somewhere in the next year, Chief, and I know you guys would be willing to do that. We have a great partnership. The tribe has been partners with the county when I was there, with the state, and now with the city. And we look forward to a continued good relationship because they're not an outside party. They're home folks just like we are. So I appreciate you all coming out today. I hope everybody's concerns were addressed. And with that, we'll conclude this meeting. And I'd like to say a big thank you to these guys.
As I always say, it's not all work at Creek Nation. We like to have fun every once in a while. And having said that, I know Representative Nichols will want me to let you know that this weekend is our 40th annual Muskogee Creek Nation Festival and Rodeo. And we expect a lot of people. We're hoping that weather, they say it's going to end raining rusty about Wednesday or Thursday. We're keeping our fingers crossed. But we feel like we'll have an outstanding weekend coming up. And also let you know, because of the partnerships that we have here in Okmulgee, for the first time in the history of our festival, the city of Okmulgee contributed $15,000 to our festival. And because of our appreciation to the city, we've asked Mayor Balders and City Manager Ballinger to be our co-parade marshals, so they'll be part of our parade this year, starting at 10 o'clock. I'm going to tease my friend Siobhan back there. We may even have an Indian car contest, so if you have a car that smokes and barely starts, we may want you to come through the parade and go out to the ball fields under a sedan if mosquitoes are bad out there. Run those cars out there too. But thank you very much for coming. And the future is bright for this community. It's just a matter of us working together. And the future is bright for the Muskogee Creek Nation because what we do, what tribes do here in Oklahoma is good for all communities. I sincerely believe that. So with that, thank you very much.